Okay, so let's just look at some other tests. So a CT angiogram. Um, Remember, we spoke about an angiogram when we spoke about PCI. This is a CT angiogram, and we'll come to it. A right heart catheterization and a left heart catheterization. So these are all just diagnostic tests looking for heart disease. Okay, so just like the Holter monitor was looking for arrhythmias in someone with dizziness or feeling palpitations in their chest, and the stress test was looking for um, signs of ischemia on the monitor while the person's on the treadmill. These are just other tests to look at the heart and for any heart disease. Okay, so here's a CT angiogram. Okay, so you get a lovely image. You can see the coronary arteries going down. Um, so it's much less invasive than a normal angiogram because with a typical angiogram, you have to go into an artery. Okay, so it's your wrist or your femoral artery, and then thread up the catheter to the heart, and then put dye in to the coronary arteries, and then see the anatomy of the coronary arteries to see if there's any blockages. A CT angiogram, okay, you get some dye put in, and they wait for the dye to get up to the heart, and then they do a CAT scan. The problem with it, so there's still radiation with this, but the problem with it is when you see something, there's nothing you can do. You still have to go on to a PCI, a percutaneous coronary intervention. So they're not overly popular because of that reason. So I have the test, I see something wrong, but I still have to go on to have the other test and procedure, which will be the PCI. Okay. Okay, so say we want to find out information about the right side of the heart. So we want really detailed information because we think that there's something wrong with the right side of the heart or that there's high pressures in the right side of the heart for some reason. So we can do a right heart catheterization. So how do we get to the right heart? Through a vein. Okay. So we insert the catheter into the vein, and that catheter has the ability to measure pressures and measure oxygen saturations. So we can get the catheter into the inferior vena cava or the superior vena cava by accessing the central circulation, and then we can get it into the right atrium, right ventricle, and pulmonary artery. And you can see the image on the left there that the catheter is coming from the jugular vein, and it's threaded down, and on the way down it's taking pressures. Okay, and look at the pressures at the right side of the heart. They're low, right? It's the venous side. So the right atrium, very low, right? 2 to 8 millimeters of mercury. Right ventricle, when it pumps, 15 to 30. Compare that to the left ventricle, 100 to 140 millimeters of mercury to overcome the pressure in the aorta. So very different pressures on the right side of the heart, much, much lower, okay? So in actual fact, the right side of the heart doesn't have to work as much as the left side of the heart, okay? It's good to know the range of those pressures, by the way. So the blood coming back into the right atrium, it's generating a pressure between 2 and 8, pretty low. The right ventricle, when it pumps, 15 to 30, and then relaxes, 2 to 8. The pulmonary artery, typically 15 to 30 during systole and 4 to 12 during diastole. Just good to know those pressures, right? So that's what a right heart catheterization is used for. And it can be helpful to diagnose pulmonary artery hypertension, right? So if you have really high pressures in your pulmonary artery, there's usually a reason for that. So what can cause pulmonary artery hypertension? Well, there's something wrong with the lungs, such as COPD, that are destroying the capillary beds, and so the blood can't flow through. That's going to lead to pulmonary artery hypertension. Left heart failure, where the left ventricle is not able to pump blood out, so it's backing up into the lungs and it's backing up to the pulmonary artery, causing high pressures. Okay? So it can give a lot of information about what's happening with the pressures and the oxygen on the right side of the heart. Now, this catheter can be left in if the patient is very ill and monitoring of the right venous pressure. So the venous pressure is, of course, on the right side of the heart, the inferior vena cava and the superior vena cava, and it can be left in for CVP monitoring. Okay? So central venous pressure monitoring. Okay, so just an overview of hemodynamic monitoring. So central venous pressure we've spoken about. They go into one of the central lines, such as the jugular or the subclavian vein. They thread a catheter in and they obtain pressures, right? So central venous pressure, so say in the vena cava, 2 to 6. Very low, right? Very low pressures. Pulmonary artery, so they thread another part of the distal lumen into the pulmonary artery, and they can get pulmonary wedge pressures, which just means they've threaded it further into the pulmonary artery, and they get a pressure as far into the pulmonary artery as possible. They can get pressures in the right ventricle, and it really just gives a good idea of how the pumping, how much pressure is being generated by the pumping of the right ventricle. What's the oxygenation of the blood returning to the right side of the heart? Now, an arterial line that's mentioned at the bottom left, that's the arterial side. So don't confuse them. We've been talking about right-sided catheterization. An arterial line goes into an artery, such as your radial artery or your femoral artery, and that obtains minute-to-minute blood pressure readings for someone who is extremely ill. Okay? In fact, hemodynamic monitoring on the right side of the heart that we're seeing here is for people that are very ill. Okay? We don't do this otherwise, okay? Because it's invasive. Okay, so here's an image showing left heart catheterization. Okay, so now that's going to have to be done through an artery to get to the left side of the heart. So they thread up a catheter and they thread it all the way up the aorta to the aortic arch and then into the left ventricle. And they can get information about the aortic valve, the mitral valve, the left ventricle, so they can measure pressures there, how much pressure the left ventricle is generating. They can look at the coronary arteries to see if they're open or blocked, and they can look at all the branches of the aortic arch, which are the branches that are going to the brain, right? So subclavian artery, carotid artery, all those they can assess with the left heart catheterization. Okay, so these are just some comparisons between the right heart cath and the left heart cath. One enters a vein, and the left heart cath enters an artery. Okay, one wants to get to the right side of the heart, one wants to get to the left side of the heart, and to obtain different information from each side of the heart. Okay. Now this image is just showing you where to apply pressure when someone's had a catheterization, especially into an artery for sure, right? So it's not necessarily where the puncture of the skin is, because that's not where the puncture of the artery is, right? it's proximal to where it went through the skin. So the pressure applied needs to be over the arterial puncture, not where it punctured the skin. Okay, so catheterization complications. Remember, to access the left side of the heart, you can use the femoral artery or the radial artery can be used to get a catheterization up to the aorta, and then finally into the left side of the heart. Okay. So, what are some complications? We've spoken about these. So, retroperitoneal bleeding would occur only if the femoral artery was used. Okay. Myocardial ischemia. So, that's with a left heart catheterization, where we threaded the catheter up, and something occurred with a complication occurred with the coronary arteries, and one of them became blocked. Okay. Bleeding at the site of insertion, sure, because you're puncturing an artery if it's a left heart catheterization. Dysrhythmias, anytime you put a probe or a catheter into either side of the heart and you touch the wall of the inner chambers of the heart, you could trigger arrhythmias, so irregular beating of the heart. Okay. Venous spasm, sure, you could cause a vein to go into spasm with a right heart catheterization. Infection is always a risk whenever you open or puncture the skin. Perforation, you could perforate an artery, which is bad news, right? Because arteries are under high pressure. You could perforate a coronary artery. You could perforate as you're threading the catheter up the aorta. Something could be accidentally perforated and cause a lot of bleeding. Okay, so those are things to think about. The device on the left is showing you a pressure device that's being applied after a femoral artery, so a left heart catheterization, right? And it's just holding the pressure there to stop the formation of a hematoma. Or even worse, an outer arterial bleed. So you really want to put pressure there to allow that artery to heal after it's been punctured. Okay, so I'm going to leave this. Slide. I think it's pretty clear. Just a pre-procedure and post-procedure for different approaches. Remember, when you're doing a femoral approach, and you've gone through the femoral artery, well, there's going to be a period of bed rest. There's going to be a period of leaving your legs straight to allow that artery to heal. So you don't want someone moving around just after they've had their their femoral artery accessed with the catheter, right? But I'll leave the rest for you on this slide, and we'll go on. Okay, so electrophysiology studies, we'll talk about these in the next module too, but what are we doing? Well, this is typically for a patient that has some kind of abnormal rhythm, right? And there are many abnormal rhythms that occur with the heart. And sometimes we send people to the EPS lab to find out which rhythm are they getting. Or sometimes we'll find some kind of odd rhythm at the hospital, and we'll send them to the EPS lab to really determine the extent of the arrhythmia. Okay, so arrhythmia, dysrhythmia, they mean the same thing, some kind of abnormal rhythm. Okay, so this lab is used to diagnose and map out in the nerves of the heart where the abnormal rhythm is coming from. Okay, so it's actually a pretty complicated process. So people that work in the EPS lab know all about the nerves of the heart in great detail. Okay, now if they find the cause of the arrhythmia and they can see that it's some kind of abnormal bundle of nerves, they can ablate it, they can burn it, right? So not only can they diagnose the arrhythmias, especially some of the deadly arrhythmias, but they can actually do procedures so that the arrhythmias don't come back, such as ablation.